Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Type I Hypersensitivity. So, what is Type I Hypersensitivity? This is an IgE-mediated response resulting in allergy, anaphylaxis, and/or atopy. Now, before we talk about Type I hypersensitivity in further depth, it's important to have a brief overview of the 4 types of hypersensitivity. These are the 4 types of hypersensitivity. So the one that we will be talking about today is IgE-mediated. In the next episode, we will talk about IgG or IgM antibody-mediated. After that, we'll be talking about immune complex-mediated hypersensitivity. And then finally, we will discuss T-cell-mediated or delayed hypersensitivity reactions. And it's important just to be aware that the first 3 are all antibody-mediated, whereas the last type is T-cell-mediated. And you may in fact recognize these 4 types of hypersensitivity from our previous talk on drug reactions, which is earlier in the Immunology series. And if you want to recap on that, or if you haven't watched it and fancy giving it a watch, then click on the link which is on your screen now. And here in this table, we can exemplify the 4 different types of hypersensitivity through the reactions to various drugs. And as I say, you will recognize this slide from our previous episode. So let's come back to Type I hypersensitivity now. This occurs in several phases. So there's firstly an immediate phase, and then there's a later phase, which we'll talk about in a while. The immediate phase happens within minutes, and this involves antigen cross-linking with IgE on pre-sensitized mast cells. This leads to immediate degranulation and the release of various pro-inflammatory chemicals, including histamine, which is a vasoactive amine, tryptase, which is a marker of mast cell activation, and leukotrienes. So this will all be quite familiar as well from our talk on anaphylaxis and drug allergy. So again, if you want to watch either of those talks, just click on the links now. The later stage of hypersensitivity occurs within hours, and this involves chemokines, which attract inflammatory cells, for example, eosinophils, and other mediators from mast cells. This leads to inflammation and tissue damage. The investigations, once again, will be familiar from the anaphylaxis and nut allergy episodes. So a skin test or a blood test or ELISA should be done for allergen-specific IgE. And as per the anaphylaxis episode, we want to identify a culprit, which involves taking a detailed history once the patient is stable, especially involving food and drugs. It's important to get a mast cell tryptase level within 6 hours, and skin prick testing and total IgE levels will also be important. If necessary, the patient will then be required to be under allergy or immunology services to ensure the management is optimized, for example, with the use of an EpiPen. So let's now do a question. Which of the following statements best describes the underlying pathogenesis of a Type I hypersensitivity reaction? So these are our options. It is mediated by IgG antibodies. It involves immune complex deposition in tissues. Mast cells and basophils release histamine and other mediators. It has a delayed onset, or it is associated with granulomatous inflammation. So in this case, the correct answer is C, that mast cells and basophils are involved in releasing histamine as well as other mediators, which we spoke about. You can hopefully see why the other answers are wrong, but these answers will all come up as we discuss the other 3 forms of hypersensitivity, and you will realize, having watched all 4 episodes, that each of these do relate to at least one of the other types. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.